Indiana has in fact received its first case of coronavirus COVID-19.
We have to emphasize again that we are well prepared. We've been waiting for this situation.
Well, 6 months ago, we were listening to those words from our state and county leaders when Indiana confirmed its very first case of coronavirus back on March 6th. And now we've grown from that one case to more than 100,000. That means in the past 6 months, about 1.5% of Hoosiers have been exposed already.
But as Fox 59's Kayla Sullivan discovered, scientists estimate that real number much higher.
6 months ago, a man traveling from Boston to Indiana was the first confirmed COVID-19 case in the state. Officials were hopeful it would never reach 100,000 cases, but estimates show it could have been much worse.
There is no ongoing risk to the public.
That was the message on March 6th when Indiana announced its first confirmed case of COVID-19. Now things are much different, but experts say it's much better than it could have been.
If we had done nothing, we had never shut down the economy, we had never shut down schools, we probably would have reached 100,000 way back in April.
Compared to surrounding states, Indiana is in the middle when it comes to total positive cases. Indiana just crossed the 100,000 mark. Ohio reports 130,000 cases. Michigan lists 117,000. Kentucky sits at 52,000. And Illinois has confirmed almost 250,000 COVID-19 cases. Since population plays a role, the numbers are only part of the story. Overall, Indiana is doing about the same as others in the area.
Our numbers are slightly different, but we're kind of moving in the same directions. Deaths have continued to kind of come down over the last several weeks.
Though the 100,000 milestone does confirm 1.5% of Hoosiers have been infected with COVID-19, the Regan Street Institute believes that number is 10 times higher.
Just because in the beginning it was hard for people to get tested. And we still, not everybody who has the infection is getting tested.
Even so, that means about 85% of Hoosiers are still susceptible to the virus.
Which means that we have to continue to be vigilant with social distancing and wearing face masks and, taking precautions to keep more people from getting the disease.
The Regan Street Institute estimates a small spike in the cases after the Labor Day weekend is complete. Then the Institute expects those numbers to stabilize before rising again in the colder months. I'm Kayla Sullivan for Fox 59 News.